Hey everyone, welcome back. Let's master the G drugs. Here's the 25 most common medications tested. Gabapentin is used to treat seizures and nerve pain, such as post-herpetic neuralgia. Gabapentin enacarbil is used to treat restless legs syndrome and post-herpetic neuralgia. Galcanezumab is used to prevent migraine headaches. Galantamine is used to treat mild to moderate Alzheimer's disease. Ganciclovir is used to treat cytomegalovirus, CM infections. Gadafloxacin is used to treat bacterial infections, including respiratory and urinary tract infections, ophthalmic form for eye infections. Gefitinib is used to treat certain types of non-small cell lung cancer. Gemcitabine is used in chemotherapy to treat various cancers, including pancreatic, breast, ovarian, and non-small cell lung cancer. Gemfibrozil is used to lower high cholesterol and triglyceride levels. Gemtuzumab ozogamicin is used to treat acute myeloid leukemia, AML. Gentamicin is used to treat various severe bacterial infections. Glatiramer acetate is used to treat relapsing forms of multiple sclerosis, MS. Glimepiride is used to lower blood sugar in people with type 2 diabetes. Glipizide is used to lower blood sugar in people with type 2 diabetes. Glucagon is used to treat severe low blood sugar, hypoglycemia. Glyburide is used to lower blood sugar in people with type 2 diabetes. Glycerin is used as a laxative to treat constipation and also in some topical preparations. Glycopyrrolate is used to reduce secretions, like saliva, during surgery, to treat peptic ulcers, and to reduce drooling. Golimumab is used to treat autoimmune diseases like rheumatoid arthritis, psoriatic arthritis, and ulcerative colitis. Goserelin is used to treat prostate cancer, breast cancer, and certain benign gynecological disorders. Granisetron is used to prevent nausea and vomiting caused by chemotherapy or radiation therapy. Grisofulvin is used to treat fungal infections of the skin, hair, and nails. Guaifenesin is used as an expectorant to help loosen phlegm and thin bronchial secretions. Guanfacine is used to treat high blood pressure and attention deficit hyperactivity disorder, ADHD. Guanfacine extended release is used to treat attention deficit hyperactivity disorder, ADHD. Let's keep going. Here are the adverse reactions of the G drugs that exams love to test. Gabapentin. Adverse reactions: dizziness, drowsiness, ataxia, impaired coordination, fatigue, nystagmus, involuntary eye movement, tremor, viral infection, peripheral edema, can also cause vision changes or trouble thinking. Gabapentin enacarbil. Adverse reactions: dizziness, drowsiness, somnolence, fatigue, nausea, headache. Galcanezumab. Adverse reactions: injection site reactions, pain, redness, swelling. Hypersensitivity reactions, for example, rash, itching, ivishivs, anaphylaxis. Galantamine adverse reactions: nausea, vomiting, diarrhea, anorexia, dizziness, headache, weight loss, syncope, bradycardia. Ganciclovir. Adverse reactions: myelosuppression, leukopenia, neutropenia, thrombocytopenia, anemia, fever, diarrhea, nausea, vomiting, abdominal pain, headache, abnormal liver function tests, phlebitis at injection site. Gadafloxacin. Adverse reactions: ophthalmic use, eye irritation, burning, stinging, conjunctival hyperemia, blurred vision, headache, taste perversion. Systemic use, if applicable, would include broader fluoroquinolone risks like tendon rupture. Gefitinib. Adverse reactions: rash, diarrhea, nausea, vomiting, anorexia, stomatitis, interstitial lung disease can be severe. Elevated liver enzymes, nail disorders. Gemcitabine. Adverse reactions: myelosuppression, neutropenia, thrombocytopenia, anemia, nausea, vomiting, flu-like syndrome, fever, chills, myalgia, rash, alopecia, dyspnea, edema. Gemfibrozil. Adverse reactions: dyspepsia, abdominal pain, diarrhea, nausea, fatigue, headache, vertigo. rash, can cause liver issues and myopathy. Gemtuzumab ozogamicin. Adverse reactions, infusion-related reactions, fever, chills, hypotension, hypoxia, respiratory failure, myelosuppression, severe, hepatotoxicity, including veno-occlusive disease, hemorrhage, infection, mucositis. Gentamicin, adverse reactions, nephrotoxicity, renal dysfunction. Ototoxicity, vestibular and auditory, can be irreversible. Neurotoxicity, for example, neuromuscular blockade, hypersensitivity reactions. Glatiramer acetate, adverse reactions, injection site reactions, pain, redness, swelling, itching, flushing, chest pain, dyspnea, palpitations, anxiety, rash, transient post-injection reaction, flushing, chest tightness, dyspnea, palpitations, anxiety, usually self-limiting. Glympyride adverse reactions, hypoglycemia, nausea, dizziness, headache, weight gain, allergic skin reactions, for example, rash, itching. Glipizide adverse reactions, hypoglycemia, nausea, diarrhea, weight gain, dizziness, headache, cholestatic jaundice, rare, allergic skin reactions. Glucagon, adverse reactions, nausea, vomiting, hypersensitivity reactions, for example, rash, difficulty breathing. Hypotension after IV injection. Tachycardia, glyburide adverse reactions, hypoglycemia, nausea, heartburn, diarrhea, weight gain, dizziness, headache, allergic skin reactions. Glycerin, adverse reactions, suppository/laxative, rectal irritation, abdominal cramping, flatulence. Topical, skin irritation, dryness. Oral, rarely used systemically, headache, dizziness, nausea, vomiting, thirst, hyperglycemia, hyperosmolar states. Glycopyrrolate. Adverse reactions, dry mouth, blurred vision, urinary retention, constipation, tachycardia, palpitations, headache, dizziness, nervousness, can cause hyperthermia. Golimumab, adverse reactions, upper respiratory tract infections, nasopharyngitis, pharyngitis, injection site reactions, headache, rash, increased risk of serious infections, for example, TB, fungal, malignancy. Goserelin adverse reactions, hot flashes, sweating, decreased libido, erectile dysfunction, men, vaginal dryness, women, injection site reactions, bone pain, initial flare in prostate cancer, cardiovascular events, for example, MI, stroke, in men. Grenisetron, adverse reactions, headache, constipation, diarrhea, asthenia, weakness, dizziness. Greseofulvin, adverse reactions, nausea, vomiting, diarrhea, headache, rash, photosensitivity, elevated liver enzymes, dizziness, fatigue, leukopenia, rare. Guaifenesin, adverse reactions, nausea, vomiting, dizziness, headache, rash. Guanfacine, adverse reactions, immediate release, drowsiness, dry mouth, dizziness, constipation, bradycardia, hypotension. Adverse reactions, extended release, somnolence, fatigue, sedation, headache, nausea, abdominal pain, dizziness, dry mouth, hypotension. Let's finish strong by doing the contraindications or black box warnings of the G drugs. Gabapentin, contraindications, hypersensitivity to gabapentin or its ingredients. Black box warning, none. Gabapentin and acarbol. Contraindications, patients who need to sleep during the daytime and remain awake at night for restless leg syndrome. Black box warning, none, but carries warnings for suicidal thoughts, behaviors, respiratory depression, and stress/multi-organ hypersensitivity. Galcanezumab, contraindications, hypersensitivity to galcanezumab or to any excipients. Black box warning, none. Galantamine contraindications, severe hepatic impairment, severe renal impairment, creatinine clearance less than 9 millimole min, hypersensitivity to galantamine. Black box warning, none, bus. Ganciclovir. Contraindications, hypersensitivity to ganciclovir or valganciclovir. Black box warning, hematologic toxicity, granulocytopenia, anemia, thrombocytopenia, and pancytopenia have been reported. Impairment of fertility, based on animal data, may cause temporary or permanent inhibition of spermatogenesis in males and suppression of fertility in females. Fetal toxicity, based on animal data, has the potential to cause birth defects in humans. Mutagenesis and carcinogenesis, based on animal data, is potentially mutagenic and carcinogenic. Gatafloxacin, ophthalmic use. Contraindications, hypersensitivity to gatafloxacin or other quinolones. Black box warning, none. Systemic fluoroquinolones have black box warnings for tendon rupture, peripheral neuropathy, CNS effects, and myasthenia gravis exacerbation, but these generally do not apply to ophthalmic formulations. Gefitinib. Contraindications, hypersensitivity to gefitinib. Black box warning, none. Gemcitabine. Contraindications, hypersensitivity to gemcitabine. Black box warning, none, but carries warnings for myelosuppression, pulmonary toxicity, hemolytic uremic syndrome, and extravasation. Gemfibrosal contraindications, hepatic dysfunction, including primary biliary cirrhosis, severe renal dysfunction, pre-existing gallbladder disease, cholelithiasis, concomitant use with simvastatin, repaglinide, or dacibuvir. Black box warning, none. Gemtuzumab ozogamicin. Contraindications, hypersensitivity to gemtuzumab ozogamicin or any excipients. Black box warning, hepatotoxicity, including veno-occlusive disease sinusoidal obstruction syndrome. Severe or fatal veno-occlusive disease has been reported. Infusion-related reactions. Life-threatening or fatal infusion-related reactions can occur. Gentamicin contraindications, hypersensitivity to gentamicin or other aminoglycosides. Black box warning, nephrotoxicity, risk of renal toxicity, which can be irreversible. Ototoxicity, risk of both vestibular and auditory ototoxicity, hearing loss and balance issues, which can be irreversible. Neurotoxicity, manifested by neuromuscular blockade and respiratory paralysis. Glatiramer acetate, contraindications, hypersensitivity to glatiramer acetate or mannitol. Black box warning, anaphylaxis, risk of a rare but serious allergic reaction called anaphylaxis, which can occur at any time, from the first dose to doses administered years later, and can be fatal. Glymepiridine contraindications, type 1 diabetes mellitus, diabetic ketoacidosis, hypersensitivity to glymepiridine or other sulfonylureas or sulfonamides. Black box warning, increased risk of cardiovascular mortality. This warning is based on a study, UGDP, with tolbutamide, another sulfonylurea, and is generally applied to the entire class. Glipizide contraindications, type 1 diabetes mellitus, diabetic ketoacidosis, hypersensitivity to glipizide or other sulfonylureas or sulfonamide disease. Black box warning, increased risk of cardiovascular mortality. This warning is based on a study, UGDP, with tolbutamide, another sulfonylurea, and is generally applied to the entire class. Glucagon contraindications, pheochromocytoma, a tumor of the adrenal gland, insulinoma, a tumor of the pancreas, hypersensitivity to glucagon or any component. Black box warning, none. Glyburide contraindications, type 1 diabetes, mellitus, diabetic ketoacidosis, hypersensitivity to glyburide or other sulfonylureas, or sulfonamides, concomitant use with bosentan. Black box warning, increased risk of cardiovascular mortality. This warning is based on a study, UGDP, with tolbutamide, another sulfonylurea, and is generally applied to the entire class. Glycerin rectal laxative use. Contraindications. Hypersensitivity to glycerin, undiagnosed abdominal pain, appendicitis, intestinal obstruction. Black box warning. None. Glycopyrrolate. Contraindications. Hypersensitivity to glycopyrrolate. Glaucoma, obstructive uropathy, for example, bladder neck obstruction due to prostatic hypertrophy. Obstructive disease of the gastrointestinal tract, for example, paralytic ileus, pyloduodenal stenosis, severe ulcerative colitis, toxic megacolon, myasthenia gravis, unless used to counteract muscarinic effects of cholinesterase inhibitors. Unstable cardiovascular status in acute hemorrhage. Black box warning. None. Golimumab contraindications. Active serious infections, including sepsis. Black box warning. Serious infections. Increased risk of serious infections leading to hospitalization or death, including tuberculosis, or TB, invasive fungal infections, and other opportunistic infections. Patients should be evaluated for TB risk factors and tested for latent TB. Malignancy, increased risk of lymphomas and other malignancies, some fatal, reported in children and adolescents treated with TNF blockers. Goserelin contraindications. Pregnancy for endometriosis, lactation, undiagnosed abnormal vaginal bleeding, hypersensitivity to LHRH, LHRH agonists, or any component of the product. Black box warning. None, but carries warnings for tumor flare, bone density loss, and cardiovascular events in men. Granisetron contraindications. Hypersensitivity to granisetron or other 5-HT3 receptor antagonists. Black box warning. None. Grisafulvin contraindications. Pregnancy, severe liver disease, porphyria, hypersensitivity to grisafulvin. Black box warning. None. Guaifenesin contraindications. Hypersensitivity to guaifenesin. Black box warning. None. Guanfacine, immediate release and extended release. Contraindications. Hypersensitivity to guanfacine. Black box warning. None. Guanfacine extended release. Contraindications. Hypersensitivity to guanfacine. Black box warning. None.